Welcome to another episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. Today's show is an update of a show we did last season on the Affordable Care Act.
And there's a lot of uncertainty right now, Phaedra, about health care reform. The economy is doing badly, frankly, and we're in the middle of a political season. Nobody knows what's going to happen with this.
It's true, Cham. And let's just remind our viewers what the Affordable Care Act was all about. It was designed to hit two parts of our healthcare system that are in trouble right now. One, rising healthcare costs, and number two, too many uninsured people in the U.S.
Well, to help us do that today, we're going to be speaking with Dr. Monica Gaughan on the faculty here in the Department of Health Policy and Management at the College of Public Health.
And we're also speaking to Elizabeth Weeks Leonard. She's on faculty at the School of Law at University of Georgia, and we're talking to Toni Miles. She's the new head of the Institute of Gerontology.
Well, if you are wondering what is going on with this Affordable Care Act and healthcare reform, this is the show you need to see.
So if you want to have a better understanding of healthcare reform, today's show is for you. Our first guest today is Dr. Toni Miles. She's the new director of the Institute of Gerontology here in the College of Public Health. And Toni has a specialty in geriatric medicine, public health, and health policy. Thank you so much for joining us today.
Thank you for having me.
I'm so interested to talk to you about this topic today, healthcare reform, because you actually had a hand in developing the legislation. How did that come about?
I was fortunate enough to be a member of the first class of Health and Aging Policy Fellows, a fellowship that was supported by Atlantic Philanthropies, and its goal was to put people with a knowledge of aging into the setting where they could influence policymakers.
Okay, and was this a 2-year fellowship or a 1-year?
One with an optional second year, which I exercised. So I had a chance to be placed on the Senate Finance Committee in the fall of 2008, and I served there until 2010.
Wow, what a great time to be there. So who did you work with while you were there?
Senator Baucus's health team, which consisted of almost 25 people working on this one major piece of legislation. It was awesome.
I can imagine. So what was your responsibility in terms of the legislation? Were there any pieces of it that you had a particular, you had to pay particular attention to?
Yes, my specific focus was the parts of the legislation dealing with the healthcare workforce. So all the clauses that involve moving medical residency slots around the country and funding those slots by Medicare were pieces that I worked on, wrote drafts of the legislation and visited with other senators' offices. It was just amazing.
Okay, other than the workforce, any other pieces of the legislation?
Spent a lot of time, of course, working on Medicare and adding the geriatric focus to that part, yes.
All right, now since you had this great experience, give us, just the typical general public an insider look at what really goes on behind the scenes in crafting legislation such as this.
Oh my God.
So process, like what happened in the process that we would never know otherwise?
Well, there's a lot more backdoor conversations that go on between members of staff to staff, senators to senators. Of course, the Gang of Six. I don't know if people remember the Gang of Six, but Baucus and those people, we watched those meetings take place. But what was most interesting to me was this: you would get a visit, usually late in the evening, from a staffer from another senator's office who, on the record, was opposed to some piece you were arguing about that day. And they'd sneak around the back and they'd say, please, 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 my boss really wants this in the bill. And of course we would say, well, is he or she gonna vote for it? And no, of course they can't. But we really want this anyway. And so it was this constant back and forth between what was happening publicly and what was happening to develop the actual legislation.
Wow, that's exciting. So you have an interest in gerontology. What's in the legislation that you were excited for it to be there? Is there anything that you wished would have been in there or could have been strengthened?
Well, the thing, probably the most important piece of it that was included after much conversation and then taken down recently was the Class Act. It's basically long-term care insurance on a federal level. It was controversial getting it in there. There was controversy about how the thing was put together, how the financing of it. And the Class Act office has been closed down. So it's clear that the Class Act is not going to be implemented as part of health reform.
And so, is it dead in the water? Is it just that it will come in its own separate piece of legislation, or in your opinion, are we really not going to see long-term health insurance?
Boy, if I could read the Washington tea leaves, I'd get a Nobel Prize for presence. We need, I will say, my own personal view is that we need it because right now the states bear the brunt of long-term care expenditures. It's not easy selling long-term care insurance to people who are paying mortgages and kids' tuition, but that's the time you need to buy it. And so it may come back simply because the populace may eventually understand they need to have this. But right now, I think it's not going to happen. The law's not been repealed, but
Right.
it's not being implemented.
And what about the groups that would be in support of it, like the AARP? Are they rallying around trying to make it come alive again?
Well, they've got bigger fish to fry. I mean, the long-term care piece, of course, is important to them, but there's also the stuff around Medicare solvency, and there's the medication pieces. So, right, and the Social Security discussions. So right now they're sort of bigger, more distracting, immediate issues.
I want to talk to you a little bit. I understand you've got a book that's coming out soon about your experiences. Why don't you tell us about that?
Oh, thank you. It actually, I've been writing about health disparities in late life for a long time, and I became aware that policy influences disparities. So the book is actually an analysis of the Affordable Care Act and its potential to address disparities, but from a very policy-driven perspective. It's called Health Reform and Disparities, History, Hype, and Hope.
Great. So when's it coming out?
May of 2012.
Great. Thank you so much for joining us.
Thank you for having me.
With me now is Dr. Monica Gaughan. She's faculty in the Department of Health Policy and Management in the College of Public Health. Monica, thanks so much for being here. We talked last season about healthcare reform. You told us all about the major components of the Affordable Care Act. Now we're talking about where we are in implementation. So I guess my first question for you is, where exactly are we in implementation?
We're at every level, federal, state, local. All are engaged in implementation, and we also have the federal court system making some decisions about implementation.
So let's start, we'll talk about the court system a little bit later. Let's first start with the federal level. What are some things that have already taken place at the federal level?
Well, the really major thing of the last year is that Medicare beneficiaries, that's the federal program that insures older adults and the disabled, almost 50 million people, now have access to free preventive care services. So for example, whereas last year they would have had to pay a significant amount for colonoscopy, mammography, pap smears, bone density scans, things of that nature, are now free as part of their Medicare benefit. So that's really the big story in this past year with respect to the federal government.
Okay, and we're in the state of Georgia. What's happening here?
Well, the really big news in Georgia and all of the states is that the federal government is providing additional money to assist them with setting up consumer assistance programs. And so I'm going to provide some information for our viewers if they want to see how to contact this office. But the office is set up so that any person in Georgia can contact the office with questions that they have about their insurance now. It's basically to set up a bridge structure between now and 2014 when these health insurance exchanges come in for people who are concerned about what's happening with their health insurance here in Georgia.
That's great, very helpful. Let's talk about state-based health exchange. I know we've had some action or inaction here in the state of Georgia on that.
Well, we've had both action and inaction, as you point out correctly. So the governor last year instituted a commission that was made up of a number of experts, including people who are in industry, other members of the political system, et cetera. I mean, it's really a great commission. And what this commission has just done is to recommend that this state should, in fact, begin establishing a health insurance exchange. I should say health insurance exchanges, because the federal law calls for both a health insurance exchange for individuals who are purchasing health insurance and also health insurance exchanges for small businesses.
Okay, so the recommendation comes out. What happens next in the state?
Well, what happens next is that we wait for the Georgia State Legislature to take action on it, because this is just a recommendation from the commission, and now our legislature will have to pass enabling legislation to make this happen.
Several things have come forward with implementation so far. What are people generally happy about with what's already been implemented?
Well, some people have really gotten some great benefits. So as we talked about last year, any child who's under the age of 26 should now have rejoined his or her parents' health insurance plan if the parent has health insurance. And so that's a real benefit, especially, you know, for students and also young adults who may be having a difficult time in the current economy finding employment with health insurance coverage. I've already discussed a little bit that Medicare beneficiaries really have gotten some additional benefits. So preventive care, that prescription drug donut hole is beginning to close, and that's something that will help seniors and disabled people who have significant medication expenses. So kind of the ones who have already gotten some benefits are pretty happy about it, I'm sure.
And the pre-existing conditions, isn't there something?
Yeah, you're right. There's two aspects of pre-existing condition clauses that have changed. Now that's when an insurance company can say, hey, we're going to insure you, but you have heart disease, and so we'll insure you for everything except heart disease. So you don't get coverage for what you really need. So where the Affordable Care Act is going is to eliminate that idea completely. But right now, as we're implementing it, it's not possible for insurance companies to have pre-existing insurance clauses for children. Okay, so we're not there yet with adults, but for children, their insurance cannot have
And
pre-existing
adults is supposed to
condition.
coming in 2014, right?
Adults is 2014,
Okay.
absolutely. And then the other feature is a high-risk insurance pool, and that's a much smaller group of people. These would be individuals who have been unable to purchase health insurance for the last 6 months, and they can document that insurance companies are unwilling to give them insurance. They can get their insurance through high-risk insurance pools that are run through the states. And that the Consumer Assistance Program I mentioned should help anybody who's interested in getting access to that do so. Now, those are expensive.
Not everyone is happy about health care reform being passed. What, in your opinion, are the things about the legislation that are still making people really upset?
Well, there's a lot in this bill, and there is a lot in this bill that hasn't yet been implemented, and some things that we don't even know how they're going to work. So I think in general, people are concerned because they're not sure what's going to happen with some of these provisions. There's a lot of uncertainty that is introduced by the fact that the bill contains some things that haven't been tried before at a national level. And there's also some uncertainty because of where we are in the political process, which is that this continues to be a major political issue. There continues to be arguments on all sides of the political spectrum about it. And so the public is watching this and thinking, gosh, what's going to happen?
Not to mention the fact that we're in an economic downturn, and so
Correct.
people are more concerned about that than they are about the health care reform. So
Exactly.
yeah. All right, my last question for you is, do you still have enthusiasm and hope that we're going to see everything implemented by 2014, or are you cautious? Where are you kind of on the mental health plane of healthcare reform?
That's a funny question. I think that the health insurance exchanges, as every state works to implement them, and they all are to a greater or lesser extent right now, they're going to see that that kind of structure is going to provide a benefit to the citizens of their state. Even if the federal government is not requiring it, that many, many states are going to say, you know, this is a good idea and we can do this, you know, even without the federal government telling us what to do. So that's my hope, is that even if other parts of this bill begin to be dismantled, like the individual mandate, that things like what the commission recommended, which is, hey, maybe Georgia should have health insurance exchanges, will continue to go along, because the problem of people being uninsured is not going to go away without pretty significant government involvement. But that doesn't have to be the federal government. The state government can do it as well.
Great, thank you so much. To help us figure out where the Affordable Care Act is in the judicial process, we're now being joined by Elizabeth Weeks Leonard, who is a professor of law in the School of Law here at the University of Georgia, and she specializes in healthcare financing and regulation. So thank you so much, Elizabeth, for coming in today.
Thanks for having me.
I'd love to hear from you on kind of where we are in the various legal challenges to the Affordable Care Act.
Well, there are 3 different challenges, and most of these were filed the day or within days of the Affordable Care Act being signed on March 23rd, 2010. So the challenges are still in the legal process, and there are 3 different specific provisions of the Act that are being challenged. One, the minimum essential coverage requirement, or what we know as the individual health insurance mandate. The requirement that employers provide coverage or health insurance options to their employees, and the expansion of Medicaid to all low-income adults.
Okay, so before we talk about the individual mandate, let's talk about the other 2 provisions that are being challenged.
Those 2 challenges are, I think, admittedly, the weaker challenges. The challenge to the employer mandate or employer penalty is that Congress has exceeded its power to regulate commerce, one of its enumerated powers under the Constitution. Most scholars that have looked at the issue have decided that this is fairly clearly within Congress's power. The Medicaid expansion provision has a slightly different challenge. It has to do with the scope of the federal power to interact with state powers. So Medicaid is a cooperative program between the federal government and states. The challenge being brought by states on that ground is that the federal government has, by expanding Medicaid, imposed new conditions on states and thereby increased their burden in terms of participating in the Medicaid program.
Okay, and then the more important of the 3 legal challenges to the individual mandate, let's hear a little bit about that.
Sure, the individual mandate is of course the one that's gotten all the press. That's what we're hearing about. This is a part of the act that requires most individuals in the United States to carry individual health insurance. The challenges are being brought by both states and by individuals against this provision. The nature of the challenge by individuals is that it infringes on your right to purchase health care the way that you want, or to spend your money the way that you want, or to receive health care the way that you want, sort of an individual rights claim. From the state's perspective, their challenge is that, again, the scope of federal power doesn't authorize this kind of legislation, thereby infringing on state powers, because under the Constitution, the federal government's powers are listed, they're enumerated, and every other residual power is left with the states. So it's really kind of a turf war between the federal government and the states.
Where are we in the process of the judicial claim here on the individual mandate?
There are 6 cases, but really 3 intermediate appellate court decisions that are pending at the U.S. Supreme Court currently. There's a decision out of the 11th Circuit Court of Appeals in Atlanta. There's a decision by the 6th Circuit Court of Appeals in Ohio, and there's a decision by the 4th Circuit Court of Appeals in Virginia. There also are a number of other opinions and lawsuits pending at the lower federal courts, both in district and circuit courts. But those are the cases that are now poised at the high court to be decided this Supreme Court term.
And what about the case that Georgia is involved in, where we're one of 26 states, I guess it is? Can you tell me a little bit more about that case?
That case is one of the ones that's pending at the U.S. Supreme Court, and it does involve 26 states as plaintiffs, as well as a few individuals and an organization representing employers, representing businesses. So that challenge includes all 3 of the causes of actions that I talked about earlier.
And what I'm most interested to hear from you is your legal opinion on whether that case what will happen with the Affordable Care Act based on the Supreme Court's decision on that case.
If the court decides that the individual mandate is unconstitutional because it exceeds Congress's power, they have 2 choices. One is to hold that that provision is unconstitutional but can be severed, can be taken out of the Affordable Care Act, and the rest of the act could stand and continue to be implemented. The other option is to hold that that individual mandate is so crucial to the overall structure of the Affordable Care Act that it's non-severable, that its unconstitutionality means that the entire legislation is unconstitutional.
And what do you think the likelihood of either of those two things happening is?
I think well, I guess the first question is on the merits of the individual mandate, whether that's unconstitutional, and then the second question is the severability issue.
Right.
On the individual mandate, the merits of it, the current Supreme Court precedent seems to support that exercise of Congress's power. There have been other cases decided in which the court has acted on what seems like an individual decision, individual activity, a local decision, but the court has held that that does affect interstate commerce, which is the federal power in question. However, there have not been cases in which, or legislation in which Congress has required individuals to purchase something from another private party. To that extent, it's unprecedented, which is why it's such an important issue for the court to hear. Nevertheless, I think that under that current precedent, it's broad enough to authorize this exercise of congressional power. On the severability question, I think the court would be hesitant to strike down the entire act based on this one portion of it being unconstitutional. Although it does make it difficult for some other parts of the act to operate as intended without the individual mandate, they could continue to function, but perhaps not quite as well without
Right.
that piece.
Right. Yeah, I guess that would be my follow-up question then, is if the individual mandate goes away, what about the Affordable Care Act will go away as a result, and what can stay? And let me also ask, are there other things that might be implemented to deal with the fact that the individual mandate is no longer there?
The difficulty with striking down the individual mandate, it most directly affects two other provisions of the Affordable Care Act that have to do with health insurance underwriting. So under the Affordable Care Act, there's a provision called guaranteed issue and another called modified community rating. And both of those provisions have the effect of preventing insurers from excluding individuals because they already have a health condition, or discriminating against them in terms of pricing, premium rating for policies because they already have a health condition. So the idea of the individual mandate is to support those restrictions on health status underwriting by requiring more people, essentially everyone, to be part of the risk pool, to have everyone, including people who don't have health conditions and might otherwise not choose to buy health insurance, in that risk pool, so that insurers aren't bearing the cost just of the expensive, already sick folks. So the concern is that from a health insurer's perspective, this just may not be economically sustainable
Right.
if people are not required to buy health insurance before they get sick.
Right. So we might see some policies to try to get people to buy insurance even if it's not mandated.
Exactly. And some of those might be, well, we could condition perhaps other types of government services, maybe college loans on people's having health insurance. We could beef up some of the provisions of the Act that make it a default, that when you work for your employer, typically now you have a choice about whether to enroll in a health insurance plan or not. We could make it the default that you are enrolled and you have to opt out if you don't want to be insured.
Which is the way it works with college students now, right? They automatically get enrolled unless they give something that says, no, we've got coverage somewhere else.
Right,
Yeah.
right. That sort of, that notion kind of turns on kind of psychology, that people are less inclined to change something than they are to stick with whatever they're
Sure.
given. So that could increase enrollment without really having people make a choice about it. We could also increase public education and outreach, those kinds of public health strategies to help people recognize the importance of having health insurance. We could place restrictions on enrollment like we have typically in an employer health plan. You have an open enrollment period once a year. We could say if people don't sign up during that open enrollment period, they may pay a penalty or some other type of incentive to encourage that enrollment.
So all may not be lost if something happens at the Supreme Court. Well, what a great time to be a law student with an interest in health. I'm sure your students are thrilled to have you and your expertise in the School of Law. So thank you very much for your insight, and we'll be watching with you very closely what happens at the Supreme Court.
Great, thanks for having me.
Well, we had a great update today on the Affordable Care Act, but think one of the things that I learned is there's still a lot of unknown, right, Jim?
You know, there is, Phaedra, normally we don't do follow-up shows on public health impact because there's so many different things in public health to cover, but we had to do another show on this. This has gone through so many changes already, but it has had a very polarizing effect on the political front, within families, everywhere.
Yeah, and I really wish people would take their emotions out of it and just, challenging them to learn about what's in the Affordable Care Act and all the problems within our system that it's trying to alleviate.
You know, this is a really interesting time. I know, when you train our health policy students, you're telling them that now. This is one of the most critical times in history. Exciting time to be in health policy, not only in our field, but for the nation.
And no matter what we do with the system, no matter what changes we come up with, there are long-term implications, so we really need to care about this.
Yeah, and one of the great paradoxes here, and that most people probably don't understand this exactly, is that the United States spends more on health care than any country in the world. And yet, for the population as a whole, we're not happy with the outcomes.
So this unsustainable growth, to me, means it's time for our leaders and the public to stop polarizing the issue, to come together and come up with some solutions that we can all be comfortable with.
Well, we want to thank our guests today for really helping us get this good and clear insight on what's going on with the Affordable Care Act and the drama that's going along with it.
So see you next time on PHI, Public Health Impact.